Right, good evening, everyone. Welcome to my Ed Talk. This evening we'll be discussing Zofran, also known as Ondansetron. Quick note here, post-op nausea and vomiting is one of the leading causes of a hospital admission um, after getting a surgery. So it's really important that we as anesthesia providers uh, prevent that from happening by giving the patient the proper medications. So, mechanism of action of Zofran, it is a 5-HT3 antagonist. So, it's going to prevent activation of inotropic 5-HT3 receptors, which in nature is excitatory with a potassium, sodium, and calcium influx. So, if we zoom in here a bit, we see our 5-HT3 receptor and how Zofran is going to bind to it and prevent binding of things like serotonin and prevent the influx of sodium. Rapid influxes of things like serotonin can cause nausea and vomiting. So Zofran works centrally and peripherally. Let's focus on centrally first. It's going to inhibit activation of the vomiting center. So our chemoreceptor trigger zone, which is located in the postrema, just outside of the brainstem, that integrates with the gag and vomiting reflex in the medulla. So the 5-HT3 receptors there are going to be blocked when taking Zofran to help prevent that from happening. And moving on to peripheral, it's going to inhibit the vagal activation. So we have our vagal nerve terminals here. And when there is a rapid influx of serotonin, 5-HT3 antagonist will block these from being opened up. So again, Zofran works on the PNS and the CNS. All right, so Zofran is the first-line agent for post-op nausea vomiting prophylaxis. Its typical dose is going to be 4 milligrams and 2 mLs, or 2 milligrams and 1 mLs. It's going to be given every 4 hours. One of the biggest things, it needs to be given prior to known triggers such as opioids, inhalation anesthetics, and before the patient is vasodilated to have its proper effect. Some adverse effects to keep in mind when giving Zofran is QT prolongation. If the patient has a history of QT prolongation or arrives to the PACU and you look at the EKG and the QT is prolonged, you probably should avoid Zofran. Any patient who receives Zofran should be on an EKG monitor at least 30 minutes after administration to avoid the QT or to monitor for the prolongation. All right, thank you.